What if your body has been quietly warning you about heart failure, and you've been ignoring it? Millions of people mistake these early signals for aging, stress, or being out of shape. But the truth is, your heart might already be struggling. Signs like sudden breathlessness while climbing stairs, swelling in your ankles, or even waking up at night gasping for air are not random. They are your heart's cry for help. In this video, I'll walk you through 13 early warning signs of heart failure that are easy to dismiss but crucial to recognize. Knowing these could save your life or the life of someone you love. Let's start with the very first one. Sign number 1, shortness of breath with routine activity. Shortness of breath is something most people dismiss. I'm just out of shape, or I'm getting older. But in reality, unexplained breathlessness during daily activities is one of the earliest and most important warning signs of heart failure. Doctors call this exertional dyspnea. It means feeling breathless while doing things that should normally be easy. Climbing a single flight of stairs, walking to the mailbox, or carrying light groceries. Why does this happen? Your heart is a pump. When healthy, it pushes oxygen-rich blood efficiently to your muscles. But if your heart weakens, it struggles to keep up. Your muscles still demand oxygen, but the supply is limited. To compensate, your lungs overwork, leaving you short of breath. The key detail is progression. At first, you might notice it occasionally, but over time, you realize you need to stop and rest more often. Tasks that used to energize you now leave you exhausted. Research from the American Heart Association shows that exertional shortness of breath can appear months before other obvious symptoms of heart failure. Sadly, many ignore it, blaming stress, weight gain, or age. If you catch yourself saying, "I get tired so easily these days," pause and pay attention. This isn't normal aging. It could be your heart struggling to keep pace. Early detection here can prevent serious complications later. Sign number 2, orthopnea. Needing extra pillows to sleep. Imagine this. You lie down to sleep, but suddenly breathing feels uncomfortable. You add a pillow. Weeks later, you need 2. Eventually, you find yourself sleeping in a recliner just to breathe easily. This is called orthopnea, and it's a major red flag for heart failure. When you lie flat, gravity is no longer helping blood return from your legs to your heart. If your heart is weak, blood begins to back up into the pulmonary veins, the vessels that return blood from the lungs to the heart. This backup leads to fluid leakage into the lungs, making it harder to breathe. Research shows orthopnea occurs in about 80% of heart failure patients. What makes it so insidious is its gradual progression. At first, it seems like a matter of comfort. I just sleep better propped up. But over time, the need for extra pillows becomes a necessity, not a preference. The dangerous part? Many rationalize it away. They think it's snoring, reflux, or simply aging. In reality, it's a signal that the heart isn't pumping effectively. The pattern is important. If you've gone from sleeping flat to multiple pillows, or even upright in a chair, don't dismiss it. Your body is telling you something critical. Sign number 3, paroxysmal nocturnal dyspnea, nighttime gasping for air. Few symptoms are as terrifying as waking in the middle of the night gasping for air. Doctors call this paroxysmal nocturnal dyspnea, PND. It feels like drowning in your sleep. Here's why it happens. During the day, fluid often collects in your legs due to gravity. When you lie down, that fluid redistributes into your circulation. For a weakened heart, this sudden increase overwhelms it, causing fluid to back up into the lungs. Hours into sleep, you wake up panicked, gasping, sometimes rushing to a window or door for air. Research shows PND episodes usually occur 2 to 4 hours after falling asleep. They can be mistaken for nightmares, anxiety, or even sleep apnea. But the hallmark difference is the sensation of suffocating, relieved only by sitting upright. This isn't just uncomfortable. It's a medical emergency warning. Studies show patients with PND are at high risk for worsening heart failure and hospitalization. If you find yourself waking repeatedly, desperate for breath, don't ignore it. This is not just poor sleep. It's your heart struggling against fluid overload. Seek medical attention immediately. Sign number 4, fatigue and reduced exercise tolerance. We all feel tired at times, but there's a difference between ordinary tiredness and the deep, unrelenting fatigue that signals heart trouble. With heart failure, the exhaustion lingers no matter how much you rest. Doctors call this reduced exercise tolerance, and it's one of the most commonly overlooked early symptoms. Here's the science. When your heart isn't pumping effectively, your body goes into survival mode. Blood flow is prioritized to your brain and heart, the essentials. That means less oxygen-rich blood reaches your muscles and other organs. The result? Profound fatigue and weakness. At first, it's subtle. You might notice your recovery time after light exercise is longer. A short walk that once left you energized now demands a long rest. Carrying groceries, climbing stairs, or even showering may feel draining. The progression is slow, so many people unconsciously adapt. They stop doing activities they once enjoyed. They make excuses, saying, "I'm just getting older." In reality, it's the heart silently struggling. Research shows fatigue and reduced stamina can appear months before more obvious signs, like swelling or chest pain. And unlike regular tiredness, this fatigue doesn't improve with extra sleep. If everyday tasks feel harder than they should, and you find yourself constantly drained, don't dismiss it as age. Persistent fatigue may be your heart's way of warning you that it needs help. Sign number 5, ankle or leg swelling, peripheral edema. One of the most visible early warning signs of heart failure is swelling in your ankles, feet, or legs, what doctors call peripheral edema. This isn't the minor puffiness you might get from sitting too long or a hot day. This swelling is persistent, symmetrical, and it worsens as the day progresses. By evening, your shoes feel tight, socks leave deep marks, and walking may feel heavy or uncomfortable. Why does this happen? A weakened heart can't pump blood effectively. As circulation slows, blood begins to pool in the lower extremities. Meanwhile, reduced blood flow to the kidneys triggers them to retain sodium and water. This combination pushes fluid from your blood vessels into surrounding tissues, causing swelling. Medical research shows edema is present in about 70% of heart failure patients at diagnosis. It usually starts in the ankles and feet, then progresses upward to calves, knees, and even thighs. One way to recognize it is the pitting test. Press your finger on the swollen area for a few seconds. If the indentation stays for several moments, that's not normal swelling. It's a sign of fluid retention. Many people blame swollen feet on long days, heat, or aging. But when swelling is symmetrical, progressive, and paired with other signs like fatigue or shortness of breath, it's your heart sending a clear warning. Sign number 6, rapid weight gain from fluid. Weight gain usually makes us think of overeating. But with heart failure, sudden weight increase often has nothing to do with food and everything to do with fluid. Doctors emphasize this is one of the most measurable early warning signs. If you gain 2 to 3 pounds in a single day or 5 pounds in a week, it's not fat. It's fluid retention. Here's why. When your heart struggles, hormones in your body react by telling your kidneys to hold on to salt and water. That excess fluid builds up in your tissues and circulation. Each kilogram of added weight equals about a liter of fluid trapped in your body. The tricky part? This weight gain often appears before you even notice swelling or shortness of breath. That's why cardiologists advise patients at risk for heart failure to weigh themselves daily. The scale is a sensitive early warning system. The weight gain from heart failure feels different than normal fluctuations. It's steady, upward, and often accompanied by bloating or fullness. Your rings may suddenly feel tight, your clothes snug, or your belly distended. This isn't about watching calories. It's your body accumulating fluid because the heart isn't strong enough to move it efficiently. If your weight rises quickly without explanation, don't shrug it off. Rapid. Unexplained weight gain is one of the most reliable red flags that your heart may be failing, and it's a signal to call your doctor immediately. Sign number 7, nocturia, frequent nighttime urination. Have you noticed you're waking up more often at night to use the bathroom? Many people blame age, drinking water before bed, or prostate issues in men. But frequent nighttime urination, called nocturia, can actually be an early warning sign of heart failure. Here's why it happens. During the day, gravity pulls fluid into your legs and lower body, especially if your heart isn't circulating blood effectively. When you lie down at night, gravity is no longer at play. That trapped fluid redistributes back into your bloodstream. Suddenly, your kidneys receive a rush of extra fluid. To compensate, they work overtime, producing more urine than usual. This is why heart failure patients often wake up 3 to 4 times per night, with larger than normal volumes of urine each time. What makes this concerning is the pattern. If you're urinating more at night than during the day, and if the output is unusually large, it's not just about drinking too much water. It could be your heart struggling to regulate fluid balance. Research shows nocturia can appear before more obvious signs like swelling or shortness of breath. It's a subtle but important red flag. If nighttime bathroom trips are becoming frequent and disruptive, especially when combined with fatigue or swelling, don't just chalk it up to aging. This could be your body telling you that your heart is under strain. Sign number 8, night cough or wheeze, especially when lying down. A nagging nighttime cough is easy to blame on allergies, asthma, or even a dry bedroom. But if you only notice coughing or wheezing when lying down, and it improves when you sit up, it may be your heart trying to get your attention. Doctors call this a cardiac cough, and it's linked to fluid buildup in the lungs. When you lie flat, excess fluid redistributes in your chest. Your lungs sense this and trigger a cough, often dry and persistent. Sometimes it produces white or pink, frothy mucus, a sign of fluid mixing with air. This isn't the same as a cold or bronchitis. Patients often describe it as a dry tickle in the throat that worsens at night, disrupting sleep. Wheezing can also accompany it, especially in the early hours of the morning. Because the symptom is subtle, many dismiss it. They say it's just allergies, or maybe I'm coming down with something. But when the cough appears only at night, or when lying flat and eases with pillows or sitting upright, it's often a sign of heart failure. Medical research confirms this nighttime cough is strongly associated with fluid overload from poor circulation. Recognizing it early can prevent further lung congestion and worsening heart strain. So, if your cough seems oddly tied to bedtime or body position, take it seriously. Your heart may be signaling for help. Sign number 9, palpitations or irregular pulse. Your heartbeat should be steady, reliable, and barely noticeable. But if you feel fluttering, pounding, or skipping beats, especially at rest, you may be experiencing palpitations, a common early sign of heart failure. Here's what's happening. When the heart muscle weakens, it struggles to pump effectively. In response, it often develops irregular rhythms, what doctors call arrhythmias. The most common is atrial fibrillation, where the upper chambers of the heart beat chaotically instead of in sync. This irregular rhythm reduces efficiency, making your heart work harder just to keep blood flowing. Patients describe it as a racing heart, a skipped beat, or even a somersault in the chest. Some feel anxious or uneasy during episodes. The relationship between heart failure and arrhythmias is two-way. An irregular rhythm can weaken the heart, and a weakened heart can trigger irregular rhythms. Left untreated, this cycle can accelerate the progression of heart failure. Palpitations often become more noticeable when lying down or resting quietly. They may last seconds or minutes and sometimes leave you lightheaded or short of breath. Not all palpitations are dangerous. Caffeine, stress, caffeine, or lack of sleep can cause them too. But when they occur regularly or alongside other heart failure symptoms like fatigue, swelling, or breathlessness, they demand serious attention. Studies show arrhythmias are present in a significant number of heart failure patients and are linked to higher risks of complications. That's why doctors take palpitations very seriously, especially in people over 40. If your heart feels like it's racing or skipping without reason, don't ignore it. Your heart rhythm may be warning you of deeper trouble. Sign number 10, dizziness or near fainting episodes. We've all felt lightheaded when standing too quickly, but when dizziness or near fainting becomes frequent, it can be a serious warning of heart failure. Doctors call these episodes syncope when they lead to fainting, and they often occur because your heart isn't pumping enough blood to your brain. Here's what happens. Normally, when you stand or exert yourself, your body adjusts by increasing heart rate and tightening blood vessels to maintain blood pressure. But in heart failure, the weakened heart can't respond quickly enough. Blood pressure drops, and your brain gets less oxygen, leading to dizziness, blurred vision, or even blackout. Clinical studies show about 20% of heart failure patients experience syncope or presyncope. These episodes may be triggered by standing up suddenly, mild exertion, or even standing still for long periods. What makes this symptom dangerous is how often it gets misattributed. People blame dehydration, medication side effects, or inner ear problems. While those can play a role, persistent or unexplained dizziness, especially with other signs like fatigue, palpitations, or swelling, may point to reduced cardiac outputting, you lose balance easily, or you nearly faint with light activity. It's not something to brush aside. These are signals that your heart might be failing to maintain stable circulation. Early medical evaluation can prevent serious complications, including sudden cardiac arrest. Sign number 11, digestive problems, bloating, poor appetite, early fullness. When people think of heart failure, digestive issues aren't the first thing that comes to mind. Yet symptoms like persistent bloating, loss of appetite, or feeling full after only a few bites are surprisingly common and often overlooked. Why does this happen? A failing heart affects your whole circulatory system, not just your chest. As blood flow weakens, your digestive organs receive less oxygen-rich blood. At the same time, fluid can build up in the abdomen, and the liver can become congested as blood backs up. The result is discomfort, nausea, and poor appetite. Patients often describe constant pressure in the stomach, early satiety, feeling full quickly, or a bloated belly that doesn't improve with typical remedies. Some even feel pain or heaviness in the upper right abdomen, where the liver sits. Medical studies confirm these gastrointestinal symptoms are linked to heart failure. But because they seem unrelated, both patients and doctors often overlook them. Many assume it's indigestion, acid reflux, or diet-related, when in fact, it's the heart struggling to circulate blood efficiently. This matters because loss of appetite and reduced food intake can worsen weakness and fatigue, creating a vicious cycle. If bloating, nausea, or early fullness persist, especially when paired with fatigue, swelling, or shortness of breath, it deserves serious attention. Remember, your gut and your heart are more connected than you think. Sign number 12, bendopnea, shortness of breath when bending forward. Imagine leaning over to tie your shoes and within 30 seconds, you feel breathless. This specific symptom, discovered in 2014, is called bendopnea, and it's a highly specific warning sign of heart failure. Here's the mechanism. When you bend forward, abdominal pressure increases, pushing against the diaphragm and raising pressure in the chest cavity. For a healthy heart, this isn't a problem. But for a weakened heart already struggling with elevated filling pressures, that extra stress makes breathing difficult almost instantly. Research shows bendopnea is present in about 30% of heart failure patients, and it's strongly linked with advanced disease and increased risk of mortality. What makes it unique is its specificity. Healthy people rarely experience it. Patients often notice it during simple tasks: tying shoes, picking up something from the floor, leaning over a sink, or gardening. The shortness of breath usually improves as soon as they sit upright again. Because bendopnea is relatively new in medical literature, many people, and even some doctors, don't recognize it right away. But it's considered such a reliable marker that researchers use it as a non-invasive indicator of high heart pressure. If you find yourself getting winded every time you bend forward, it's not just aging or being out of shape. It's a very specific signal that your heart is struggling with fluid overload and pressure. Don't ignore this unique but telling red flag. Sign number 13, cold hands and feet. Narrow pulse pressure. Your hands and feet can reveal a lot about your heart. If they're persistently cold, even in warm weather, or your blood pressure readings show a narrow pulse pressure, these may be subtle but important early signs of heart failure. When your heart can't pump effectively, your body makes choices. It diverts blood to vital organs like the brain and heart, while reducing flow to the extremities. This leaves your hands and feet cold, sometimes with a bluish tinge in the fingers, toes, or even lips. Patients often describe their hands as icy or notice they take much longer to warm up. These changes may also be accompanied by numbness or tingling sensations. Another related clue is narrow pulse pressure, the difference between the top systolic and bottom diastolic numbers in a blood pressure reading. Normally, this difference is about 40 millimeters of mercury, but in heart failure, the gap narrows, signaling reduced stroke volume, meaning your heart isn't pumping out enough blood with each beat. These circulatory changes tend to develop gradually. At first, you may blame poor circulation, aging, or even the weather. But when paired with other heart failure symptoms like fatigue, swelling, or shortness of breath, they're a clear warning that your heart is under strain. Cold hands and feet may seem minor, but they're your body's way of telling you that blood flow is being prioritized and your heart is struggling. So there you have it, 13 early warning signs of heart failure that are often mistaken for aging, stress, or lifestyle changes. From shortness of breath and swelling to night coughs, palpitations, and even cold hands, your body sends signals long before a crisis occurs. The key is not to panic, but not to ignore these red flags either. If you recognize one or more of these symptoms in yourself or a loved one, seek medical evaluation promptly. Early detection and treatment can make a life-changing difference. If this video helped you, type helpful in the comments. Share it with someone you care about. And don't forget to like and subscribe for more doctor-guided health insights. Take charge of your heart today.